What I find drives or convinces a child's parents to go for treatment with Invisalign is, I think, first and foremost going through kind of the pros and cons, the benefits of actually using an aligner therapy like Invisalign versus traditional braces or functional appliances. So you've got your normal benefits of, comfort, efficiency, speed, reduced appointment times, I think it's 40%, reduced emergencies, compatibility with general day-to-day life, making sure that they don't have any restrictions in their diet. I think that's really key because kids love to eat their food and parents don't want to come in all the time for emergencies. So all those pros and cons I think are really important. But I think when historically you find that orthodontic treatment is only ever done once all the adult teeth or permanent dentition is established, I think it's important that we try and build that understanding in with the parents about actually there are benefits of having treatment much earlier, and waiting until growth is almost finished or till the permanent dentition is established is not actually ideal or optimal for the child. And of course it's child specific. So I think it's having that conversation with them. The other thing is actually also to talk about emotion. So we know that behavioural change is driven by emotion. So finding out why they've come in. Is it that the child is suffering at school? Are they having some bullying? Is there any other reason? Are they unable to eat? And trying to really get down to the root cause. What I do find is that if parents are heard, the child is listened to, I feel that you get a much better connection. And then they can make that connection between the treatment that you're providing and the outcome that they're looking for. So I think that's really key. I also think it's important to talk them through the processes and the stages of treatment, especially if they're a young child, because they don't know what to expect. Engaging them, empowering them, getting them to use the digital technology such as the iTero scanner is fantastic. Demonstrating on the scanner once you've done the 3D, so you can use the pen, mark out areas, explain to them about you've got constricted upper arch, or you've got crowding here, there's not enough space for the canine to come. If we do simple maths and measure that space to this space, making them understand. It's not something that they're used to, looking into a mouth or looking in an x-ray. So really talking them through the process of what we're looking at and making it quite accessible for them in terms of the information that they're receiving. So I think that's a really key way of actually getting them involved, engaged, and driving them towards treatment. And thirdly, I think it's really key to show them some before and afters. Nothing works better than a picture. They say it paints 1,000 words, but really you can see from there how the child has developed and changed from one start photo to the end photo. And yes, with Interceptive or Invisalign first, it might not be absolutely perfect. But it shows the change in the severity of the malocclusion and how important that impact has had on the child. Testimonials really help, previous reviews and things like this. So I think if you kind of on a 360 get them involved in treatment, make them understand or show them what the benefits are of treatment, and then of course show them kind of any previous cases that you've got. If you explain everything to them, you show them, they can feel what the positive impact and change would be. And then they're able to, see that backed up with evidence from previous patients. There's no reason why they would be driven towards taking that treatment up. At the end of the day, they want the best for their child. And if you're convinced that that's the best thing for them in terms of their treatment, there's not really anything else.